Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pneumonia. Pediatrics. Introduction. Pneumonia is an inflammation and infection of the lungs. Every year, thousands of American children die of pneumonia. It can affect any child, but is most dangerous to babies and kids who are already sick with something else. Preventing pneumonia is always better than treating it. It's good for you to know what to watch for in case your child gets pneumonia. Treating it early gives your child the best chance for recovery. This patient education program will help you understand what causes children to get pneumonia. It will also explain the different types of pneumonia, how it makes your child feel, and how your child's doctor can diagnose and treat it. Most importantly, you'll find out how to prevent it in the first place. The lungs. Pneumonia is an infection of the lung. This section reviews the different parts of the respiratory system. It will also explain how the immune system helps prevent lung infections. The lungs allow us to fill our blood with oxygen. The oxygen we breathe is absorbed into our blood through tissue in the lungs. When we breathe in, the air goes through our mouth and nose. From there it goes to the pharynx. The pharynx divides into two tubes or pipes. 1. The windpipe, which goes to the lungs. It is called the trachea. 2. The tube that goes to the stomach. It is called the esophagus. Before swallowing, there is nothing in the throat. The windpipe is open and you breathe. When you swallow, the food is pushed into the throat and the windpipe closes off. Food then slides down the tube that goes to your stomach. From the windpipe, the air you breathe goes into a bunch of little tubes called bronchial tubes. These are located on each side of the lungs. At the end of the bronchial tubes are small balloon-like sacs called alveoli. The walls of the alveoli are very thin. Around the outside of the alveoli are small blood vessels. Oxygen that you breathe in goes through the very thin wall of the alveoli and into the bloodstream. CO2 goes the other way through the thin alveoli wall, from your blood to your lungs to be breathed out. All along the insides of your bronchial tubes, you have a substance called mucus. The mucus helps trap dirt from the air you breathe in. The mucus comes out when you cough. Very small brushes called cilia on the outside of the lung cells continuously push the mucus to the outside. If the mucus gets too big, you cough it out. If you breathe in air that has germs in it, your immune system protects your lungs from getting infected. In fact, the germs that cause pneumonia are usually in the air you breathe, but your body keeps them from going into your lungs and causing a problem. Sometimes the germs are able to get past your immune system and down into your lungs. When that happens, you could get pneumonia. Pneumonia. Pneumonia makes your child's lungs swell up. This is the immune system's normal response to things it is not used to. Germs, such as bacteria or viruses, are things your child's immune system isn't used to, and they cause swelling. When a child has pneumonia, his or her lungs can fill with pus and fluid. This makes it hard for oxygen to get into the bloodstream. With pneumonia, a child might have trouble breathing and have a cough and a fever. How serious pneumonia is depends on several things. The health of the child, the type of pneumonia, and how bad it is are important. Since children are usually healthy, their pneumonia can almost always be treated successfully. If a child has other health problems, it may be harder to treat his or her pneumonia. It is also more likely that the child will develop complications. Sometimes these complications can be fatal. There are more than 50 kinds of pneumonia. Bacteria cause bacterial pneumonias. Viruses cause viral pneumonias. Fungi, mycoplasma, and other organisms cause other types of infectious pneumonia. Pneumonia can affect one or both lungs. When it infects both lungs, it is sometimes called double pneumonia. Community-acquired pneumonia means pneumonia your child gets from the community, such as at school or daycare. Hospital-acquired pneumonia is a serious pneumonia your child can get at a hospital or a healthcare facility. It usually affects children who have to use a breathing machine, are in the intensive care unit, or have a weak immune system. Aspiration pneumonia is when the wrong thing goes into the lungs. An example of this is when vomit gets into the lungs after a child throws up. This usually happens when the child can't control his or her swallowing to stop the vomit from going into the lungs. For instance, this could happen to a child with brain injury. When vomit, food, or liquids other than water enter the lungs, they cause a chemical reaction that makes the lungs swell up. A lot of times, when the lungs swell up, bacteria are able to multiply, which makes the pneumonia worse. Being able to swallow properly keeps the windpipe closed when food or other things pass through your throat. Walking pneumonia refers to pneumonia that is mild enough that you may not even know your child has it. In other words, your child may be able to walk around with this type of pneumonia. Babies have a higher risk of getting pneumonia. Other things that put a child at a higher risk of pneumonia include immune deficiency diseases such as HIV/AIDS, chronic illnesses such as heart disease or diabetes, secondhand smoke, being around toxic fumes and pollutants.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Signs and symptoms of pneumonia vary greatly depending on any other conditions you may have and the type of organism causing the infection. There are many symptoms of pneumonia, and some of them, like a fever, cough, or sore throat, are associated with many other common infections. Often, children get pneumonia after they've had the flu or a cold. Most children have a few, but not all, of the following symptoms when they have pneumonia: fever, chills, cough, faster breathing than normal, wheezing, difficulty breathing, refusing to eat or drink, becoming dehydrated, having blue discoloration of the skin, lips, or nails. This is called cyanosis. This happens when there isn't enough oxygen in the blood. Less common symptoms of pneumonia include chest or stomach pain, loss of appetite, exhaustion, vomiting. When bacteria cause pneumonia, your child may get sick quickly with a high fever and have difficulty breathing. When a virus causes it, symptoms show up more gradually and may be less severe. When to see a doctor. If you think your child may have pneumonia, don't hesitate to get medical care. A severe case of pneumonia can be life-threatening. See your doctor right away if your child has any of these symptoms: cough that does not go away, shortness of breath, chest pain that changes as your child breathes, an unexplained fever, especially a fever of 102 degrees Fahrenheit or higher for 2 or more days, along with chills and sweats. If your child suddenly feels worse after a cold or the flu. Make sure to take your child to the pediatrician if you suspect he or she has pneumonia. Children with diseases that impair the immune system, such as AIDS, are particularly vulnerable to pneumonia. Diagnosis. The doctor may first suspect that your child has pneumonia based on your child's medical history and a physical exam. During the exam, the doctor will listen to your child's lungs with a stethoscope. He or she will listen for bubbling or crackling sounds and for rumblings that mean there's liquid in the lungs. Any of these sounds could mean your child's lungs are swollen from infection. Your child's doctor may also order chest x-rays to make sure your child has pneumonia and to find out how bad the infection is and where it's at. If the x-rays aren't clear, your child may need to have a CT scan, which takes computerized x-rays. Your child may also have blood tests to check his or her white blood cell count or to check for viruses, bacteria, or other organisms. The doctor may examine a sample of your child's spit or blood to try to figure out what is causing the illness. Once in a while, the doctor needs to do a bronchoscopy. It's a test that lets the doctor put a special scope into the lungs. During a bronchoscopy, the doctor can clear out some of the pus and mucus that can't be coughed out. He or she may also be able to get a sample from the area of the pneumonia. This helps the doctor find out exactly what's causing the pneumonia. Once the doctor knows what organism is causing the pneumonia, he or she can prescribe treatment that will help make your child better. Treatment. Children who have bacterial or atypical pneumonia will probably be given antibiotics to take at home. If your child has this type of pneumonia, the doctor will also tell you to give your child plenty of fluids and lots of rest. Drinking fluids, especially water, keeps your child from becoming dehydrated and also helps loosen mucus in the lungs. There are also antiviral medications that can lessen the severity of certain viral infections if taken in the first 1 to 2 days after symptoms begin. Give your child all of his or her prescribed medications. Stopping prescribed medications too soon can cause the pneumonia to come back. Follow the instructions that came with the medications and give your child all the doses on time. With proper treatment, most types of pneumonia are cured within a week or 2. In severe cases of pneumonia, it may take longer to completely recover. Keep all of your follow-up appointments. Even though your child may feel better, his or her lungs may still be infected. It is important to have your doctor monitor your child's progress. Sometimes children with severe pneumonia need to stay in the hospital to get better. When children with pneumonia are hospitalized, treatment may include IV antibiotics, which are antibiotics that are given through a plastic tube inserted into a vein. Respiratory therapy, which helps the child breathe. Prevention. The germs that cause many types of pneumonia can be spread through coughing and sneezing. You can prevent pneumonia by following good habits. Cough or sneeze into a tissue. Don't share drinking glasses and eating utensils. Wash your hands a lot with warm soapy water or use hand sanitizer if you are not near soap and water. If your child has pneumonia, do not visit older people, babies, or other sick people. Some types of pneumonia happen when the immune system is weak. To prevent this type of pneumonia, here are some tips for keeping your children healthy. Make sure they get enough sleep. Keep them away from secondhand smoke. Provide healthy meals and snacks. Encourage activities. Get routine vaccines and flu shots. Flu vaccinations are recommended since pneumonia often occurs as a complication of the flu.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. Pneumonia is an infection and swelling of the lung. There are more than 50 types of pneumonia. Since children are usually healthy, their pneumonia can almost always be treated successfully. See your pediatrician right away if your child has any of these symptoms. Cough that does not go away. Shortness of breath or difficulty breathing. Chest pain that changes as they breathe. An unexplained fever. Preventing pneumonia is always better than treating it. You can prevent pneumonia by using good habits and living healthy.
Thank you for using Explain.